Okay, we today we continue to have our panel available to our school board to ask any specific questions you all might have. I know that obviously this is the hot topic in Monroe, being covered in the press, as we are one of a few of the school districts in Snohomish County who are utilizing the recommendation and the guidance from the Snohomish County Health District, which was originally published on October 20th. That's when we originally communicated with the school board about Dr. Spitter's revelation that they were continuing to support the decision-making tree, especially here in Snohomish County with his role in Snohomish County. Those recommendations were published on the 20th. The most recent update from the Snohomish County Health District happened on November 6th. There was an update on the website, Snohomish County Health District website, in their news releases, which goes into a little more detail on Dr. Spitter's role. And in addition to that, talks specifically about the research that's coming out. I think we had a staff meeting last week, a staff Zoom, and we had a number of teachers attend that staff Zoom, along with a number of paraeducators and other staff members from around the district. And I think if I could capture probably the biggest confusion or concern is around how can case rates in Snohomish County be rising and us continue to move forward with our hybrid model. So I think that's one that we've heard in the public comments. We received emails around question. That was kind of a driving question from the staff meeting last week. So I've asked Greg Burns. Greg is our Director of Risk Management and Safety. I think safety and risk management is actually the order of that. Greg has been in close contact with Snohomish County Health District, along with Snohomish County Emergency Management Systems, sometimes twice weekly. At one point, the frequency of those meetings decreased a little bit, and then with the uptick, they have continued to be weekly. In addition to that, we have a weekly briefing with Snohomish County Schools. So this includes all public schools and all private schools in Snohomish County. Private schools are kind of leading the way, I would say. For example, the one closest to us, Monroe Christian School. Monroe Christian School has been in person since September. And much of the decline, one of the things that the board you have asked us about is where did our almost 10% of our population from last year, we saw that in Brenda's report, where can we attribute that attrition to? Much of that attrition, and I'm not going to vary out there and suggest a percentage, but roughly a third to a half of that, we lost families and their students, their children, to private schools because of the in-person services that a lot of the private Christian schools, for example, are having in-person learning. And in addition to that, then we have a number of our community members that have opted to homeschool their students this year. So again, Snohomish County Health District, we have now a weekly meeting. It was bi-weekly, and then with the uptick in COVID cases, it returned to a weekly meeting. Greg is in attendance with those in addition to the management. And I was going to have Greg provide the board an update on this most recent news. In addition to that, he's going to touch on the Department of Health. Washington State Department of Health released a study from epidemiologists that are funded through the Bill and Melinda Gates Foundation. So very telling research that was released last Thursday in a large press release as well. So Greg, I'm going to turn that over to you.
Yeah, thanks. So really, I want to step back here and try to summarize the concern that I've been seeing and hearing from some individuals in our community. And essentially it's that our current case rate is past what it was in March. And anybody can go on, look at this, it's public data. We're skyrocketing. There's absolutely no question that this is true. We were averaging over a 2-week spectrum, 125 cases per 100,000. My guess is that in the next few weeks, the new numbers are going to indicate that that number might even be north of 150 confirmed cases per 100,000. And when this happened in March, we had a very specific response. We closed schools, we isolated, we shut everything down, we sent individuals home. Our government and our community sent out clear messages that it was unsafe with case rates that were going as high as it was to come into school. It was unsafe. That is the concern that we're hearing right now. And I want to recognize, and I know the board recognizes this already, but I want to confirm this concern and question is entirely reasonable and it's exceptionally legitimate. So to frame our conversation, from an emergency management perspective, I want to give us a little bit of context. And this is Emergency Management 101. In a disaster, the situation continually changes and it happens rapidly. That is the definition of an emergency. And that's what we're in right now. We're in a national disaster. That requires us to have very intentional situational awareness. And I can attest that the most common breakdown that I see in any disaster response is communication. Communication breaks down and expectations break down. And I give that as a context here because I think that's a healthy reminder for our leadership to communicate and then communicate more and communicate more and communicate more. Communication is key in a situation like this. And it's also a reminder to all of our stakeholders to remain flexible because the situation is changing. It will not be the same as it was before. In fact, we can't even expect a disaster-based situation to remain stagnant at all. So we have to assume that communication, directives, and responses to new information is also changing. And sometimes that happens on short notice. So with that as our backdrop, I will acknowledge to the board that I am not a pediatrician, I'm not an epidemiologist, and I'm not an infectious disease expert, but as Dr. Blasco says, we know where to find those people. And in fact, there are some that think there's some debate on who the experts are. That's actually not really true. The Washington State Administrative Code, Chapter 246, 110.020, very clearly designates Dr. Spitters as the Snohomish County Health Officer and therefore the regional authority in charge of any actions, and I'm quoting here, that may be necessary to control or eliminate the spread of contagious diseases within the community. That is his legally defined role. He is mandated to do that. And that includes, and we know he's got the authority to do this because we saw it in March. These actions include closing all or part of schools, canceling school activities, or canceling functions at schools. And he is mandated by Washington state law to do that when people are at risk. That is his legally defined job. And we are required as a school district, we cannot disobey his orders. That would be, well, let's not get into the criminal and litigation side of things, but that would not be a good idea. We need to comply with our local health officer. This is the safest thing to do for our kids, for our staff, and also for reducing liability. So that brings us to, what does this individual say? And fortunately, Dr. Spitters has kept this communication on the forefront of his brain, and he has communicated with us in an amazing way. I will give him credit for keeping these doors open for communication. And I just want to point out a couple of quotes. This is from some correspondence that we have from him in writing, and also overall what I've been communicating with him directly. And this is the big takeaway from March summarized, and then I'm just going to read it off to you. Even though we have increased transmission rates like we haven't seen before, our knowledge about what is happening and what COVID is and how it's spreading and what that looks like in schools has also increased, and therefore the situation has changed. And so the experts who are the pediatricians and the infectious disease experts, this is what they're saying. And I'll start with Lacey Ferrenbach. She is the Deputy Secretary of Health for Washington State, not just Snohomish County. And she indicated directly to us on Thursday. So this is real-time data. Our case rate was over 125 per 100,000 people. And she says this: it appears we can get students back into physical buildings without increasing risk of COVID in the community. And in that same briefing, they also pointed out, and again, this is a quote, there is no significant increased risk comparing hybrid on-site K through 5 phase-in to full remote learning. And they showed some models. This was in the press release that Dr. Blasco just quoted, where the Center of Disease Control modeled what we know about COVID and transmission rates. And the data, I'm going to be honest, the data blew my mind when I saw what they had. And I'll summarize it briefly. The data comparisons for transmitting and spreading COVID-19 in our community for a full remote model, schools are 100% remote, there are no kids in the classroom, was higher than if kids were in a controlled in-person hybrid model. It was amazing. Now, the significance was not a great significance. There wasn't a 10% difference. Really, the numbers were very, very close for a hybrid phased-in return model and a full remote model. But this is obviously based on what we're seeing with our regional health authority, with state recommendations. But I'll also say this, they conveyed to us in that meeting that they are considering and currently modifying the decision tree that lists the numbers, like 75 per 100,000, high risk. They're modifying those numbers based on the information that they have, and they expect to release that soon. And let me tell you, those numbers aren't going to go down. They're going to say most likely that it is safer if there's a higher number of individuals in the community to phase in even more. That is 100% the strong inference that they have given us in our in-person meetings. And I'll let Dr. Spitters directly say the rest. And I'm going to read off a paragraph that he put to us in writing. And again, this is the man who is, under Washington state law, the authority on the matter. That I don't consider that to be a debate. This is the expert, and this is what he says. He says, thus far, the community-wide increase in COVID-19 transmission is not linked to transmission in schools, but rather it's been driven by transmission in private social gatherings where masks are not being worn, and in some workplaces with social distancing or other prevention deficits. While sporadic cases and clusters of cases have been and will continue to be detected in school settings, both with and without in-person learning, mitigation and control efforts have been successful. And he goes all the way down to saying, I'm going to skip down to the bottom. He talks a little bit about that modeling study that I just gave you guys some information on. He says, the public health community interpretation of the COVID-19 literature is that the preponderance of the empiric data suggests that while transmission from elementary school-age children may occur, it is substantially lower in relative magnitude compared to older children and adults. Our current thinking, and this is the experts, is that schools conducting cohorted, hybrid, in-person learning with prevention measures in place are deemed unlikely to experience uncontrolled transmission, nor are they likely to exacerbate community-based transmission. And essentially what he's saying is that you ought to bring in your younger learners and your learners that are farthest from educational justice, because what we're doing by not having them in the classroom is probably hurting them more than anything that's going to be happening with COVID in our community. This is the strong indication that they have gone on record and put in writing. And I'll say that for a government agency to do that in such uncertain times means they're very certain about this data, because the liability can point back to them in that particular case. So I will note that a lot of this data, in fact, all of this data was based on having prevention measures in place. And I think that the Monroe School District was one of the first to have a robust safety plan Every single site, we are mandating to have an incident action plan for kids to come back on site. I am going out and auditing those places. And we have several layers of protection. And I do want the board and everybody else to understand this. The reason why we mandate NPIs, social distancing, and masks, and other PPE, and hand washing, and attestations and screening in the building, we have all of these measures because not any single one is sufficient to mitigate risk. And that's because we have holes. We're always going to have holes in that safety plan. But when we stack all of those things together, we get a plan that mitigates risk to a reasonable level. And again, as the Department of Health has suggested in writing, that risk is actually lower than what it would be if we were in a 100% remote-based model. And I don't think there's any other way to interpret that data. So with that said, there's a whole bunch of different expectations and perceptions in our community. And I'm unfortunate it's not my job to balance those things. That is our elected officials who get to balance that. But what I'm seeing from the state regarding data is, yes, absolutely the worst case increase in COVID-19 in our community that we have seen since this pandemic began, and a preponderance of empiric data that suggests we need to be getting our young kids back into the classroom because we can. And again, if there was danger to our community, to our kids under Washington state law, it is the local Department of Health's authority to mandate closure of classes, closure of schools, restrictions of functions and events. And we know that they're willing to do that because they have, and they're not. They're not right now. Essentially what it comes down to is Department of Health, if communities want to back off and go into a remote learning model, the data suggests that that's not significantly more dangerous than a hybrid model, and so be it. They're allowing local control to make that decision. And for schools that want to phase in kids because they think that's valuable, they're saying go for it because there's not significant increased risk by doing that. That is where the data stands. And I think that is probably a conclusion of what we've learned just in the last few weeks. And I'm going to conclude with where I started. This is a disaster. And what that means is that flexibility as communication changes for all of our stakeholders, that flexibility is the most important, because if we get rooted in what previous historical expectations are, we will find ourselves operating in the past. And in any disaster, the situation changes, and it changes rapidly. We need to be able to be flexible and move with that disaster. That's going to allow us to be effective. It's not going to stimulate divisiveness. It will bring us together, and we're going to get through it if we stick together in that context. So that's all I got for you, Dr. Blasco.